Hello everyone, today's topic is on sternocleidomastoid muscle, which is an important muscle in the neck, and it is a key muscle because it divides the neck into anterior and posterior triangles. And let's see the muscle in detail. So sternocleidomastoid, it is present obliquely in the neck and it divides the neck into anterior triangle and posterior triangle, and it is enclosed by the deep cervical fascia. So here we can see the impression of sternocleidomastoid muscle. It gains origin from the sternum and the clavicle. So the part which is getting origin from the sternum is called sternal head, and the part which gets origin from the clavicle is called clavicular head. Both the heads join together and finally inserts into the mastoid process. So you can see the insertion to the mastoid process, gaining its origin from the clavicle and sternum both. Nerve supply to the sternocleidomastoid, motor supply is by spinal accessory nerve. So 11th cranial nerve, that is the spinal part of 11th cranial nerve, supplies the motor supply. Proprioceptive fibers, ventral rami of C2 and C3. So proprioception, that is the position sense, is because of ventral rami of C2 and C3 from cervical plexus. Then applied significance, wry neck, the shortening of abnormal shortening of sternocleidomastoid results in wry neck, and spasmodic torticollis, repeated painful contraction of sternocleidomastoid resulting in a bending of neck to one side, that is called as spasmodic torticollis. And shortening of sternocleidomastoid can be acquired and congenital both. And congenital by birth, there is a spasm of sternocleidomastoid muscle. Acquired, it is due to some pain or spasm. They tend to keep the bending of the head like this. So this is the wry neck and spasmodic torticollis. Let's see the few questions related to sternocleidomastoid. So digastric muscles are the following except. So here you can see digastric means the muscle which are having two bellies which are connected by means of intermediate tendon. So occipitofrontalis is a muscle which is having both sides, occipitalis and frontalis. So it is a digastric muscle. And omohyoid, it has got superior belly and inferior belly. And ligament of Treitz, which is present in the abdomen, it also has got two bellies. So the answer here is sternocleidomastoid. Sternocleidomastoid just gets origin from sternum clavicle and inserts into mastoid. It is not having any two bellies, so it is not a digastric muscle. Then what is false about the sternocleidomastoid? It arises from sternum clavicle, that we know, and inserts into mastoid process. Of course, it is true. And motor supply is by spinal accessory nerve. This is also true. So the answer is, the answer could be the tilt the head towards the opposite side. So the action of sternocleidomastoid here, I want to talk about its action. It helps to the tilting the head towards the same side and turns the chin towards the opposite side. So head towards the same side and chin towards the opposite side. So the false statement is this. The true statement is tilt the head towards the same side and chin towards opposite side. Which structures can be felt in the lower part of the medial border of sternocleidomastoid? So lower border, medial border of the sternocleidomastoid, we can feel the common carotid artery. We can feel the pulsations of common carotid artery, which is pressed against the transverse process of C6 vertebra. So this completes the sternocleidomastoid anatomy. Thank you.